Director General of the Ghana Health Service also states available data continues to show a decline in active cases with recoveries on the rise. He says the active cases only 18% are symptomatic, with 2 severe cases, 8 critical, with 4 persons on ventilators. Public health expert with the Kumasi Center for Collaborative Research and lecturer at the School of Public Health at the KNUST, Dr. John Amwesi, joins me via Zoom for more analysis on this. Doc, I'm grateful for your time.
It's my pleasure, Aisha, and greetings to you and to all the listeners.
How does it come to you now that that our focus for the testing of COVID-19 will only be on symptomatic cases and, health workers and students?
No, thanks for that, Aisha. I listened to the presentation by the Director General, and I think this decision might be informed by a couple of things. When you're in a country like ours that has relatively limited resources and also a rising number of cases, the question would be, how do you adequately use the little that you have? The essence of testing is so that you can treat appropriately, and also so that you can provide information which would help someone who is positive to stay clear or to steer clear from the rest of the population, so they reduce the probability of putting others at risk or infecting other people. With regard to focusing on those who are symptomatic, the question would be, what do we mean by somebody who's symptomatic? Is somebody symptomatic when they have a headache only, or when they have a fever and a headache, or when they have a tummy ache, as we know people are presenting with even just tummy aches and have a test and it's COVID. There are several other people who have been caught in the net of being positive simply because maybe someone at the workplace was tested positive, and so when they did a general sweep, they were found to be positive even though they were otherwise asymptomatic. Or they may have had symptoms but may have missed it today. May have missed it today and later were found to be positive. For example, I had a headache 2 days ago, and I took some paracetamol and I was just fine. If it should turn out to be COVID sometime later, then it doesn't mean that I was symptomatic and now I'm no longer symptomatic. So the question of symptomaticity, I'm just trying to point out that it's not very straightforward. So when the directive is that we'll focus on those who are symptomatic, is it those who say they are not feeling well, or it is those who present to the hospital saying that they are not well? Is there a specific criteria? And for those of us who work in research, we normally like to have very clear what we call inclusion criteria. So I'd love to hear from the Ghana Health Service, and I'm pretty sure they'll be coming up with this soon, what the criteria for somebody who's symptomatic is. But is it also could it be perhaps at the discretion of the health worker, where they say, well, somebody's presenting and I think there's a need to test? Who makes that decision that A is eligible for a test, B is not eligible for a test, even though they may have a headache, may have a fever, may have some body aches and this kind of thing? But
what does this mean to our fight against COVID-19 in this country?
You know, what is most important in the fight against COVID, as I've pointed out a couple of times, is our ability to, as quickly as possible, identify people who have the disease. What you're trying to do is to reduce the spread. And to reduce the spread, the one thing is identifying those who are positive and preventing them from passing it on to others, or reducing the probability of them passing it on. And so key to this is the testing. Without the testing, or without the screening and testing, you cannot achieve this. So while the tests are now going to be targeted at those who are symptomatic, it will have to be coupled with an increase in the levels or the amount of testing for those who we claim are symptomatic. And again, I've not seen the inclusion criteria for symptomaticity, or what we call symptomatic and worthy of a test, because I don't think if someone just goes to the hospital and say, hey, I had a headache in the night, and I hear headache could be a symptom of COVID, so can I have a test? I don't think the health workers are going to say, yes, you qualify as symptomatic or suspected case, so here, have a test. I don't think we want to be encouraging Ghanaians, everybody has a headache or a slight headache or body pain just to go to hospital and get a COVID test. I don't think that's going to happen. So the key for me would be to clearly define what we mean by somebody who's symptomatic and eligible for a test.
But generally, once we stop testing, aggressive testing, definitely is going to affect our fight.
Let me put it this way. The testing is your eyes on the ground, right? Now, there is what you see and what you don't see. What ultimately you will see is the impact of the disease. And I've always maintained over the past couple of months that you can be testing good, testing bad, or doing whatever. Ultimately, the deaths will show through, or your hospitalizations will always show through. Whether you're testing or not, your death and your hospitalizations will show through. The key is if you do more testing, hopefully you can catch people early and reduce the risk of progression to severe disease, therefore reduce your risk of hospitalization and risk of death. Now, the idea is those who are showing signs and symptoms are those who are more likely to go to the hospital to be hospitalized. So it makes good sense to say, well, if you are symptomatic or showing some signs and symptoms, please show up as quickly as you can to the hospital so we can test you, because it means you are at risk of progressing to severe disease and therefore death, and we need to catch you early. Because we have over 70% of those who get the virus who will be showing absolutely nothing at all. But I return to my question, which is, what is our definition of symptomaticity? Who meets the cut to have a test? I think this is the question we should be posing. If we get this clear, I think that we would be on the right track. So I think the Ghana Health Service has taken the right decisions, but we would need more clarity on what qualifies as symptomatic and deserving of a test. If we can do this, I think we would be in a good place.
Again, Doc, the issue of when asymptomatic cases recover is becoming a concern for many, seeing that some people are discharged after 10 days but take ill shortly after that. Should we be reviewing that policy? It's a bit of a difficult one, and I may need just a little bit of time to expand on this. The WHO came up with this recommendation regarding discharge from isolation centers, which focused on a 10 plus 4 days of being asymptomatic, being worthy of discharge from the hospital. Now, what that means is if you were at an isolation center because you tested positive, and we know that in isolation centers, we have people who test positive but are otherwise just fine and not really having any severe signs or symptoms, maybe just limited to the odd headache and body pain here and there. You will not find people who have easy fatigability or breathlessness in an isolation center. You will not find people with what we call a high fever in an isolation center. So when somebody is identified as positive and for 10 plus 4 days, 14 days, they are not showing any sign or symptom, then they can be released. This is the recommendation from the WHO. What could be happening is people may be later showing symptoms. And this is why we would hear of people who are discharged and later might be feeling ill. It's very difficult to place a handle on this because it's all a function of date test was taken, date result was known, date they were admitted at the isolation center. And as was rightly pointed out, we're having a situation where people are getting their results sometimes a week after they were tested. So to be able to conclude that we are having people who are being discharged after 10 days and are having problems, we need to establish, were they really asymptomatic throughout for 14 days clear before they were discharged? Could it be that maybe the policy is not being followed strictly enough? I do not know. I do not have any information on this.
but it would be pretty odd for someone to be in an isolation center, to be symptom-free for 14 days, and go home and then now develop symptoms. That would be pretty odd.
Doc, before I let you go, our active cases has reduced drastically to 3,505. That's good news, but how do we sustain the gains made? Because definitely still people are not adhering to the protocols.
No, actually, I think that's a great question, and it speaks to what I've been trying to hammer, which is not to focus on the cases. Where I think we should be focusing is two things: the hospitalization rate, how full our ICUs or hospitals getting, and most importantly, the death rate. How many people are dying out of those who are hospitalized or out of those who are put on ventilators? This is the most important thing. The active cases you have, I can tell you without a shadow of a doubt that there'll be more than 10 times that actual number out there. And we just do not know. The evidence from all over the world suggests that whatever number that you're able to determine, you most likely have more than 10 times that number. So we shouldn't be excited about having such a low number of active cases. Neither should we be disappointed if there were many more active cases. The focus should be on our beds getting full, our healthcare workers, are they being overstretched, and the deaths, are they getting out of hand? And that's what I really encourage the media to focus on, because that's the most important thing right now. As for the active cases, there will be more in the next coming weeks. This is only guaranteed. But what is going to be the hospitalization rate and the death rate that we project? I think that's the most important thing right now.
Dr. Amoisi, I'm grateful that you joined us. I really appreciate your time. Dr. Amoisi is a public health scientist with the KCCR and also a lecturer at KNUST. But